my name is Brian Bloom, and this is the certification video for airway obstruction on infants. So the first thing I do is when I come on the scene is I'll check the scene for safety. If the parent or guardian is there, I'll ask them for permission to treat the victim. I'll identify myself and give them the certification that I have, the training that I have in order to treat the baby. Next, I will check the baby for responsiveness. In this case, I know that they're unconscious. I'll tap the baby's foot, shout, and see if I can get a response from the baby. Next, what I'll do is I'll have someone call 911 and get an AED. So once the scene is clear, I've identified myself, I've checked for responsiveness, I know that the infant is unresponsive, is I'll go ahead and perform CPR on the infant. So I'll have the infant where the neck and head is supported, and then what I'll do to find the breastbone is I'll use my middle and thumb to find the infant's nipples. I'm sorry, my ring and thumb finger, and then I'll use my middle and index finger to do the compressions. So once I find the breastbone, I'll be going 1.5 inches compressions for 30 seconds. 30 compressions in 18 seconds. So once I've done that, I'll use my breathing barrier. I'll put my mouth over their nose and their mouth, and then I will do 2 breaths. After the first breath, if I don't see the chest move, I'll try one more time, and if it still doesn't move, I'll go back to chest compressions. Once I do the 30 compressions over again, what I'll do is I'll look in the mouth to see if there's any sort of object. If I see something in there, I'll use my pinky finger, my little finger, and use the sweeping motion to hook the object out. If there was something and I did get it out, I'll go back to the chest compressions if I don't see any sort of signs of life. But if I don't see anything, I'll continue chest compressions and breaths until I can and see an object that I can get out. And I'll continue this as a cycle until EMS arrives, until the scene becomes unsafe. If I see signs of life, or I become too tired to continue care, or if I have someone else that I can switch with. That was it for this video. Thank you.